A review into last month's baby mix-up at the KK Women's and Children's Hospital has found poor system checks in place. The committee says staff did not follow procedures. 3 nurses have since been dealt with, while 14 others were warned or counselled. More measures are also being implemented to prevent future mix-ups.
The mix-up was triggered by 2 babies being put in wrong cots in the nursery. So when the identification tag fell off the leg of one baby, it was replaced with the wrong one. The committee said it's not clear when the babies were placed in the wrong cots. But what's clear is that the tags were not checked carefully during discharge, and the babies ended up going home with the wrong parents. Fortunately, the mistake was quickly discovered, and the babies reunited with their parents the same day. The committee concluded that the incident happened because staff failed to comply with procedures. 3 staff nurses directly involved in the incident have been taken to task. They were suspended for a week with no pay, taken out of clinical duties for at least 3 months, and issued written warnings. KKH said the nurses were very remorseful and have learnt from the incident. 14 others, including 2 ward managers, were given warnings or counselled. KKH CEO Professor Kenneth Kwek said the hospital is committed to preventing any repeat of the mistake, and it has tightened measures following the committee's recommendations. These include having 2 staff members involved in the tagging of babies, getting parents to verify the child's identity, and proper documentation to track the movement of babies and when their identification tags are replaced. The roles of staff must also be clearly defined to avoid confusion. Daily audits are now conducted to ensure staff comply with the protocols. The hospital will also review the design of cot cards to ensure key information is clearly displayed. Parents welcome the ramped-up measures.
Of course, it's a good idea because as a parent, I'll be very feel assured if I know that I'm going back with the right child.
I think they have a good idea having the father to move along with the baby and make sure that it's tagged correctly.
It's important because we're the one who give birth the baby and we need to see our real baby. So if this system is improved, I don't think there will be this kind of thing happen again.
The Health Ministry says KKH must work harder to safeguard its patients and reinforce a culture of safety across the organisation. Separately, KKH says it has offered to compensate both families but declined details.